Hello friends, welcome to our YouTube channel, Gajpal Learning. In this video we are going to study about the topic, method of endpoint detection and titration selectivity. So let's start the video. Method of endpoint detection. Endpoint detection is a critical aspect of titration, which is a laboratory technique used to determine the concentration of a substance in a sample by reacting it with a known volume or concentration of a reagent, titrant, until a specific reaction is complete. Endpoint detection methods are used to identify when the reaction has reached completion, allowing for the accurate determination of the analyte's concentration. There are primarily two methods for endpoint detection, the indicators method and instrumental methods. 1. Indicators method for endpoint detection. Under this, A. pH indicators. pH indicators are substances that change color over a specific pH range. They are often used in acid-base titrations. Example, phenolphthalein is colorless in acidic solutions, pH less than 7, and turns pink in basic solutions, pH greater than 8.2. The indicator's color transition occurs approximately at or near the equivalence point of the titration. B. Redox indicators. Redox indicators undergo a change in color when the concentration of oxidized and reduced forms of a substance changes during a redox titration. Example, potassium permanganate, KMNO4, is purple and changes to colorless when it reacts with reducing agents. The disappearance of the indicator's color indicates the endpoint. C. Complexation indicators. Complexation indicators form colored complexes with specific metal icons. Example, aerochrome black tea forms a wine red complex with calcium icons, Ca2+, and the color changes to blue as the complex forms. The color change signals the endpoint of the titration. Second, instrumental methods for endpoint detection. Under this, A. Potentiometric endpoint detection. In this method, a pH meter or potentiometer is used to measure changes in voltage or pH throughout the titration. For an acid-base titration, the pH meter displays a sudden change in pH at or near the equivalence point. The endpoint is reached when the pH remains constant or changes very slowly. Second, conductometric endpoint detection. Conductometry measures the electrical conductivity of a solution, which depends on the concentration of ions in the solution. During a titration, conductance increases or decreases dramatically at the equivalence point. This change in conductance signals the endpoint. Third, combination of methods. In complex titrations or when high precision is required, a combination of methods may be used. For example, in an acid-base titration, a pH indicator may be used initially to approximate the endpoint, and then a pH meter is employed to precisely determine the endpoint when the pH stabilizes. Choosing the right method. The choice of endpoint detection method depends on several factors. A. Type of titration. Different methods are more suitable for different types of titrations, such as acid-base, redox, or complexometric titrations. B. Nature of the analyte and titrant. Consider the chemistry of the reaction and whether it involves changes in pH, color, or electrical conductivity. C. Expected pH change. If the pH changes significantly at the endpoint, pH indicators or potentiometric methods are often used. D. Availability of equipment. The choice may also depend on the equipment available in the laboratory. Note: proper selection of the endpoint detection method is crucial for obtaining accurate and reliable results in titration experiments. It ensures that the endpoint is detected with precision and helps determine the concentration of the analyte in the sample. Next is titration selectivity. Titration selectivity refers to the ability of a titration method to accurately and selectively determine the concentration of a specific analyte, substance of interest, in the presence of other substances or potential interfering species in a sample. Achieving selectivity is critical in analytical chemistry because many real-world samples are complex and may contain multiple components. Here's a detailed explanation of titration selectivity. Factors affecting titration selectivity. First, choice of titrant and indicator. Selecting the appropriate titrant, the solution of known concentration, and indicator, if applicable, is crucial. They should react specifically with the analyte of interest, showing minimal or no reaction with interfering substances. Second, titration conditions. Adjusting the pH, temperature, and other experimental conditions can enhance selectivity. Some reactions are pH dependent, so controlling the pH may prevent unwanted reactions. Third, sample pretreatment. Prior to titration, the sample may undergo various pretreatment steps, such as filtration, extraction, or digestion, to remove or isolate the analyte from interfering substances. Fourth, complexation or masking. In complexometric titrations, chelating agents can selectively complex with the analyte, preventing interference from other ions. Masking agents may also be used to suppress the reactivity of interfering ions. Fifth, sequential titration. In cases where there are multiple analytes in a sample, sequential titrations may be performed. Each analyte is titrated separately, ensuring selectivity for each component. Examples of titration selectivity. First, acid-base titrations. In an acid-base titration, the choice of the titrant and the pH of the solution can determine selectivity. For example, a strong base titrant, example, sodium hydroxide, can selectively titrate a strong acid, example, hydrochloric acid, without interference from weak acids. Second, complexometric titrations. Complexometric titrations use chelating agents, example, EDTA, to selectively titrate metal ions. For instance, ADTA can be used to selectively titrate calcium ions, Ca2+, in the presence of magnesium ions, Mg2+, by adjusting the pH. Third, redox titrations. In redox titrations, the choice of the titrant and the potential of the redox indicator electrode can enhance selectivity. For example, potassium dichromate can selectively titrate ions, Fa2+, in the presence of other metal ions. Challenges in achieving selectivity. Achieving selectivity in titration can be challenging when the interfering species have similar chemical properties or reactivity to the analyte. In such cases, careful method development and optimization are necessary. Sometimes, complex sample matrices or unknown components can make it difficult to achieve high selectivity. Advanced analytical techniques like chromatography or spectroscopy may be used in conjunction with titration to enhance selectivity. In summary, titration selectivity is essential for accurate analytical results in the presence of potential interferences. Careful consideration of titrant, indicator, experimental conditions, and sample pretreatment can help achieve the desired level of selectivity in titration methods. Thanks for watching this video. If our videos were helpful, then please kindly subscribe to our channel and hit the bell icon so that you can get the notification of our newly uploaded video. Thank you.